Welcome to 97.7 FM, the city. We want to welcome all our viewers that are watching us through Facebook Live, YouTube Live, listening to us over 97.7 FM. Welcome to Nature's Remedies with Dr. B. It's another great show, and it's part two of How Not to Die.
How Not to Die, yes. Remember, we are studying the book of Dr. G. She's a medical examiner, and she used to have a show like doing autopsies. And by seeing so many things there that should not be on her table that could be preventable people to die, so she wrote that book. So the book is very interesting. So we are talking about what she wrote that could be
Fantastic.
prevent people to be or they visit the doctor or they visit the ME. So like or they go to the necrotory. So they have to
Yes.
choose. Because here, the slide one, please. So it's just a review a little bit.
Mhm.
Slide one is the or you visited the MD or you
Mhm.
visited the ME. The first thing was odontophobia. Did you get to the slides?
Yeah.
One?
Slides one is up.
Things there.
There we go.
Should not be on her thing. Okay.
That's right.
So the first one is odontophobia. So I saw people losing the patients losing the liver or the kidney because they don't visit the dentist. They have an open cavity. They can have a heart infection. They can die from a heart infection, or they can have liver or kidney failure. Like one time, I received a patient that he had a swollen face, and then the labs, the CBC, the CMP, and homocysteine and CRP were elevate. Then liver enzymes were elevate, infection. And then you say, look, you have a liver failure, but you must have something in the mouth because your face is swollen. Probably you have an infection in the mouth. When twice this happened, he went to the dentist. The first time was abscess. The second time was a broken tooth and was infected. So twice he went to almost liver failure just because of the tooth. And I did receive patients with the same situation with cancer. When I opened the mouth, it was a black cavity. I did have one patient that did die from heart infection. When I opened, was black hole in her mouth, but we didn't have time for to go fix it because she fell in the hospital and then she went home. Few days later, she went to the hospital. When I saw the cavity, she didn't have time to go to the dentist. She died from heart infection. So you should have your mouth like no cavities, no metals, no amalgams, and when they have a periodontitis, they should take care too, because all this they can be sick or liver or kidney or heart. Okay, so and cancer too. It'll give you cancer. Then latrophobia, that we study that is when they are afraid of doctors. They're afraid of needles, so they feel sick, but they don't go to the doctor, and then could be too late because lack of a timely medical care. So that's meaning you're diabetic, you never did the lab work, you never check the glucose, or you never check your blood pressure. You can die from AVC, um, stroke, if you never check your blood pressure, and if you never check your glucose, you can have diabetes. When it's too late, you lose your eyes and you could lose your leg because you never treat your diabetics. That's called lack of a timely medical care. And the other thing important that we talked about was about the heart attack, because sometimes the heart attack could be silenced and you don't have no symptoms, and the only symptoms that we could have is the, like Dr. G called, the pink stomach, because when people comes to, they die suddenly and they were not sick before. So the first thing she did is open the stomach and she saw pink, so that they took Pepto-Bismol. So that means they have indigestion every night for a few days, 1 week prior the heart attack. Sometimes could be the only symptoms that they have.
Mhm.
So we do have to check sometimes your glucose, sometimes your blood pressure, to avoid to get that point, because sooner or later you visited the MD or ME. So you have to make a choice. We here in the Valley, I used to work on the ER, And I saw many times 35 years old, 45 years old come with a heart attack, and they never been to the doctor. They never check their blood pressure. Because if you have a blood pressure, you don't take care for 2 years, you're gonna die. Oh, the first thing that would happen, the hearts enlarge the left ventricle, and they cannot pump no more. So that they can die from the heart attack. And they have to take care of the blood pressure, because it's 2 years without taking care of bad high blood pressure. It's enough time to kill you. So then we just going to review the next slide, what kind of symptoms might interrupt your day or your sleep. So that's mean when you have any of those symptoms, you should go visit the doctor. Like when you have a short of breath, when you have a chest pain or abdominal pain, acute, fainting, suddenly disease, confusion, societal feelings. Like usually this is going to happen more when they take medicines for antidepressant, and one side effects could be one of that. Or if the person is severe depressed, they can have those thoughts. The person that is going to kill himself, usually they quiet, they don't tell. And the person that is tell that they're going to kill themselves, they want attention. But it's we can help them to like guide them to a psychologist, a Christian one, so to help this kid or this teenager. Or usually women has a lot of problem with depression too, because the thyroid, they if they do a lab work, they could be normal. It's called subclinical thyroid. They have the symptoms, but the lab is normal. So when they have a thyroid problem, they usually has problems with the like feelings too. And usually when they are sad, they are lacking B12 when they have a sadden problem, sadness. And then we have you should go to the doctor too when you have severe or sudden headache, severe vomiting or diarrhea, coughing blood, vomiting blood, loss of conscience, seizures, and persistent fever or severe back pain. Because sometimes severe back pain could be a sign of heart attack too. Because lately, the heart attack is becoming conventional, the signs, the symptoms, and could be just a severe back pain, and the next day the person can have a heart attack. Now, let's go for the slide. It's called a heart attack. So two more. It's showing heart attack there? Okay, because here's the delay. Heart attack. So when you go to the hospital, the typical pain is squeezy pain on the chest pain. But we have the main we call angina pectoris, but that will be the last symptoms when the person is highly dehydrated, like they don't drink water. So that is the last sign that they stimulate dehydration. And they go to the ER and they don't have nothing on the heart. It was just dehydration, especially if they are outside gardening in a hot day. So they go low in potassium and they can have like angina pectoris, but it's just the dehydration. And then you're going to have a feeling of fullness, pressure that lasts several minutes, lightheadedness, short of breath, sweating, nauseous, pain that may radiate either to the shoulder or to the back, or the arms or hands, and the neck or jaw. And in that case, you should take aspirin and then call 911 and go to the hospital. And here, the next slide, it's heart problem signs. So if you have those four, you have a heart problem. So you need to go make a checkup and do the EKG. Like here, the grease is on the ears. Like when you have double bilateral, your heart is really bad. It's clogged up. And then when you look at the luni on your hands, instead of having 8 luni, you have 10. You have on the pink. We're supposed to have only 8 lanula. When you have 10, you have clogged up arteries in both sides. And then if your tip of your tongue is red, and it's a heart problem. So when you have this combination, all four, you do have already heart problems. So you should have a check with a cardiologist and do some as labs and some testing, to AKG to test. Now, what we're going to see the different today, it's called the second part, the how not to die part 2.
The next slide, right?
The next slide. Two deadly prescription. So when we always have an unhappy ending when this deadly prescription could be like how not to die from medications mishaps, what you must know about adverse effects, because sometimes if you're going to take something and the side effects is too many, it's you have better to change or look for another option. Polypharmacy, food drug interactions, and drug and alcohol, because a lot of people drink they are drinking medicine, but they drink alcohol, they don't know that neutralizes, or sometimes uh, can lead to death if it's antidepressant and alcohol. Continue the next slides. So drugs and herbs, drugs and smoke, adverse drug effects, the fight the risk. OTC is supplements over the counter, alert, dietary supplements, and not what the doctor order. So we're going to see all this today, all these topics today. And then here, the first mistake, the next slides. Dr. G saw in her morgue, but I saw in the hospital too. And not one case, many cases. Sometimes teenagers against the fathers, they are taking anticonception pills and nobody knows they are taking, and they have a circulation problem. And that can create a clot and they can die. Like, for example, this case here that we see on the slide, left ischemic colitis caused by birth control pills prior her death. So that's mean she had a clot that clogged up her intestine, and then the rotten, and then when she died was not enough time to save the kid. Usually teenagers do that, but in the hospital, I used to work in ICU, and we did have a young lady that she was in the hospital and she was going to go to the floor. And that night she was calling me all night. And I say, okay, I'm going to have patience and answer each time she, I guess God impressed my mind to do that, because she was calling every 5 minutes and her boyfriend was there. And then I say, oh no, I'm going to be patient and I'm going to be very polite to this young lady. So I attended her all night. And then by 11 o'clock, she died. It was a bilateral clot. Yes. Sometimes people take the birth control pills and they don't know that they have a circulation problem. They can have clots. It's meant to have clots on the lungs or intestine. And the intestine takes longer to detect it, but when they detect it, the intestine, part of the intestine is rotten already. They can die because blood poisoning. So it's very important that everybody that is in birth control have a supervision of a doctor, and to see if they have any problem with the blood clots or circulation problem. The next one, and that's a polypharmacy. That's one was from Dr. G. She examined this person. She was 60-year-old. She had 25 drugs per day. So die for interaction, because like when we taking drugs, too many medicines, usually they have the medicine intern, the cardiologists, they have different doctors, but they don't check the drugs to see if they are contradicting each other or synergize each other. Like one time we had one patient that she say, I cannot swallow. And then she was sent to a GI specialist. When he got all her medication, she had 3 medications with HCl. HCl means a diuretic. So she had 3 medicines with HCl. And then each medication takes 25% of your water. With 3, So she was skinny already, and with three, she was extremely dehydrated of those three medicines. That's why she couldn't swallow anything. She said, "I cannot pass the food. It got stuck here." It's because she was extremely dehydrated. Then the GI doctor called all her doctors and changed the medications to take the regular one, not with ACL, and the problem was solved. But in this case here, the problem wasn't solved. She died. And so she was taking antacids, that is a blood thinner, and causes blood thinner, and absorption is slowly. And then she was taking aspirin, increase the bleeding. So they react to each other, so increase the bleeding. So that's why she ended up dying. And another medication that causes them to die, like when they take for osteoporosis, and the medication, like if the patient is take the medication and is in bed confined, the medication stops on one place only, and then causes a ulcer, and they die from bleeding. They can die from bleeding. So when they take those medication for osteoporosis, they should be walking, like if the patients are sitting down, because I was going to fall in the same place and can create irritation, gastritis, and ulcer. And I did have one person that died from that. So, and then drugs and alcohol. They can depress the CNA, the central nervous system. Like for example, if the person is alcoholic, drink heavy chronic drinking damages the liver. And then even if she stopped drinking or he stopped drinking, but he has to depend on diazepam to sleep or things like that, the liver is not the same, because this person damaged the liver. So her liver or his liver is not metabolizing or processing the drugs like supposed to. And then he depends on diazepam, Valium, or Darvon, and they mix, and then they decide to drink again. If they mix with alcohol, is a deadly combination. They will die. And another thing that, and this is a daily occurrence in the morgue. So people mix those things, this kind of medication, the diazepam, Valium, Darvon, with alcohol, and as a cause of death. And another cause of death for people who drink, they don't know the 1 ounce of hard liquor take 2 hours for the liver to process. Like one day that you not well on the mind, you go and do like this with the bottle, you kill yourself. You poison your brain, because the liver takes 2 hours to metabolize 1 ounce of the alcohol. And this
Wow.
was another case on her table, that the person will drink quickly 1 bottle of a hard liquor, and she died quickly because the liver couldn't process. It's a poison for the brain. So that's how they die. The next slides, we're going to talk about drugs and herbs. Like for example, people, they self-medicate themselves, even though if it's a natural medicine, they should have a supervision, a doctor, because they might not get in the right dose, and then they'll say, "Oh, it's not going to work." Because one time I had one person that she was taking glucosamino and chondroitin for the joints, and then I say, "Why are you going to have the surgery? Why you didn't try first to drink this to see if it helps your knee?" She say, "I drink, it didn't work." I say, "How much you take?" And then she told me how much she's taking. I say, "It's not enough." You see, a lot of people take, but it's not the right dose is not enough. And then here we can see the St. John's wort combined with Prozac. Its antidepressants cause excess of neurotransmitter, serotonin, and then the person is going to have confusion and nauseas and diarrhea. So they cannot mix St. John's with Prozac. Doesn't work. So you have to know all these things. And another thing that you cannot mix, when you take warfarin and ginkgo biloba, they can cause bleeding, because biloba is a blood thinner, warfarin is a blood thinner. So you take one or other. You cannot take both. Then you can have easy bleeding. And then another thing, when they take ginkgo biloba and garlic, they both are blood thinners. So if they're gonna have a surgery, they have to stop 7 days prior the surgery to avoid bleeding or excess of bleeding during the surgery, like anesthesia or high blood pressure. So A lot of people do things on their own manner without supervised. Sometimes they don't get the results they're supposed to because they don't have supervision, or they're not taking enough, or they combine wrong, or they taking two the same. One time it happened too. I had one client that clogged his leg, both legs clogged with calcification from, and then he got a diabetic foot on one leg. He went to Houston and scrape and clean up the other leg. Then he said, I don't want to do another surgery. Can you help me? I say, yeah, I can help you. Then I told the wife to bring all the supplements he was taking, and most of the supplements was full of calcium. So that he was overdosing himself on calcium. And then he had a calcification on both legs. One was already clean, and the other one he got an ulcer on the foot. I say, okay, let's try to clean up. And the first thing that we did, we went through all his supplements, and they say just one because everything has calcium. Then we changed the supplements to avoid so many calcium. And then he got better and never had that problem before. You see, even though it's natural, we have to see if you can combine herbs, and you can, when you do integrative medicine, you need to know if you're not taking the same herb and a medicine that it does the same thing. On this case here, if the person is taking warfarin and ginkgo biloba, they are the same. Okay, so you have to know all those things. On most of these cases, a mistake of lack of knowledge. And then the next slide, we're going to talk about drug and smoke. So when people smoke, and nicotine and other tobacco products can speed up the metabolism of some drugs, so increase the side effects of the drugs. So we have to be careful with that. And the next one is slide 7, adverse drugs side effects. So fight the risk. For that, we have to instruct ourselves. Like if they prescribe a medication for you, you should go to medscape.com or drugs.com for you to see the side effects interactions, so you can know what to avoid, what you can do, what you cannot do. Like for example, here we have a COX 2 inhibitors is for arthritic pain, withdraw from the market due to an increase of risk of heart attack. So you a lot of people die from heart attack by taking this, so they remove from the market. So when you prescribe a drug, you should go Medscape or drugs.com to investigate the side effects. Because if this drug is not for you, you can ask your doctor to change. Now we're going to do number 8. So here on this case was unfortunately a mistake done by the pharmacy. Okay, before was to do a lot of mistakes because of the doctor handwriting, but now we're doing everything on the computer, so this mistake is not often no more. But it still can be misread by the pharmacy. Like for example, here was that child, that young 10 years old, because was a pharmaceutical error, took a methadone instead Ritalin, because Ritalin, the name is methylphenidate, and then they gave methadone instead, look like, but it's totally different, because Ritalin is for when you have ADD, when you have ADD8, autism, so that's for a treatment for that. And methadone is blood poison. So the child died from blood poisoning. And so that was confused. They mistaken the methadone for methylphenidate. So that was a mistake, pharmaceutical mistake. Now the next one, we're going to see common errors. The first one, mistaken identity, like the wrong person. like they don't read the identification, give the wrong medication for the wrong person. The second one, misspelled address, like the pharmacy deliver and got the wrong place, wrong drug or wrong dose. Got the wrong drug or wrong dose, like the child. What happened to the child? Look alike the drug's name, so that was method confused too. Prescription, understanding, and clarity. So this mistake we don't have too much anymore because most of the things we're doing in computer. The prescriptions right in the computer. Wrong bag, like you're in a hurry and put the medication wrong or pick it up the wrong one. Uh, Report and another mistakes that the patients, this is all the mistakes that she saw what happened with the person that died that was on her table to examining. So this is all true stories. And report side effects immediately, like you start taking a medication and you have a severe side effects and you don't call your doctor to change or to stop immediately that medication. And then electronic prescription to avoid errors and computer recognition of a possible drug interaction. So now they are putting in the computer to recognize drug interaction. But like that case that I told you that the person had severe dehydration was 3 drugs with HCl, that's a diuretic, and then she was extremely dehydration. But now the computers are helping us to detect and pick it up those errors, because when you put in the computer all the medications that you're taking, all the herbs that you take, the computer can cross and tells you the problem right there. Now, as a doctor, I'm MD too. So, but I here I work only as naturopath physician, and I work only with nutraceuticals. It's a professional products, but we have over the count too, and a lot of people drink those supplements. But the mistakes that I see people doing with those supplements, that's like, for example, if they're gonna take a multivitamin, needs to be
slide number 9, right?
yes. If they're going to take a multivitamin, it needs to be whole food source. Okay. Like, for example, here I put a picture of the vitamin E. If they're going to take a vitamin E, it needs to be alpha tocopherol. If it's DL, it's synthetic. Instead, helping your liver is going to damage your liver, it's going to scar your liver. So you have to know all those things. And people, or sometimes they have a bag of supplements. There's no need to take this bag of supplements. So what they're doing is just messing up the liver. So they really need to educate themselves or get a supervision to take all this, because poly OCT supplements. That's because I'm a naturopath physician. I see more. They bring a bag full of supplements. There is no need for all these supplements, and needs to have supervision. And most of this mistake, what I see is lack of knowledge and lack of supervision. Like I say, the case that she had a knee problem and she was going to have a surgery because the glucosamine that she take wasn't the right dose, so it didn't work. And we have to see supplements interaction too, because if the person takes garlic, ginkgo biloba, and another one that blood thin, so it's 3. There's no need for that either. They're going to be bleeding. And pharmaceutical too, like so people talk to each other and they learn things, but they never consult the doctor. One time, a friend of mine, they told her to lose weight, she could take aspirin, like 325 at bedtime. So what happened? She started with a headache, and she went all doctors. They couldn't figure out what's wrong with her. And then her son took her to the doctors, and they went to a neurologist. And then he say, "What are you taking?" And then she say, "I take aspirin at nighttime, 325." What she did, her brain was leaking, like the arteries was like dripping. Not too much blood, just enough to give a headache. And then she say, "You cannot take those things without supervision." And then she stopped taking the aspirin at nighttime, 225 milligrams, and then the pain was gone. She could have killed herself of bleeding. So this is lack of knowledge. And then we finish for today. And then here, the next slide we're going to see is the book that we are talking about. All those things is real, did happen. And she decided to write this book to help people to educate themselves for not to die early or unnecessary to be on any body stable medical examiner. Her name is she had a program before, very old. It's called Americans Medical Examiner. It's called Dr. G. And and she's surprising on live longer, safe, and healthy. That was the purpose of this book and the program, to educate people. And her name is, the next slide is Dr. Jen Garavaglia, MD. So her knowledge is amazing because what she saw, that could be many people that she saw that should not be there. That all these could be preventable. So we're going to continue. I think one more day talking. Next episode we're going to be in Spanish, but we're going to one more, and then we finish with this. I think it's a very interesting book. Like really tells a lot of things to improve. Like what she say here, the last one. Here it's to live longer, safe, and healthier. That's the purpose for this where we're learning now.
That's right. And let's go to the very last slide with your information on your clinic. Now, thank you for bringing it. And as Dr. B was saying, we're going to continue this topic because it's a very extensive topic. In the next 2 weeks, we're going to do the Spanish version.
Yeah, the Spanish version
of this presentation. So go ahead and tell your friends about that. And then in 4 weeks or in a month, we're going to do the part 3 of how not to die. So make sure that you tune in. Make sure that you're telling your friends about it. Make sure you're sharing the link of this program, so that you can share this vital information to them. And I know that you're going to have questions about this. You can always contact Dr. Shirley Barbosa at 956-631-1664. That's 956-631-1664. You can get a hold of her here in McAllen. Her clinic is located off 10th Street, 508 North 10th Street, Suite C10 in McAllen, Texas. You can always send her an email at naturesremediesctr@yahoo.com. That's naturesremediesctr@yahoo.com. Well, thank you very much, Doctor, for bringing this, vital information. Is there anything you want to say before we wrap up?
Yes, her name is Dr. G, and I got my name Dr. B is because one time I was one client called me from England, and I think he couldn't spell my name. It was too complicated for him to say all the time, so he started calling me Dr. B. And then he was in England, and now he's in California. He's a dentist, and that's how I become Dr. B, because he couldn't speak my name. So, but it was interesting. But I really like this topic because it's integrative medicine, like pharmaceutical and natural medicine. But we really need to know what we're doing. Like even though if it's only pharmaceutical, like the case that I say, 3 medicines with HCl is a diuretic, cannot go together. Or ginkgo biloba with warfarin cannot go together. So we need to learn. We need to self-educate ourselves.
That is true.
Yeah.
And we need to be, we can't, I guess, we have to educate ourselves, like Dr. B was saying, because I know there's lots of cases, and I know in my personal life and with, dealing with my folks and my parents and watching the medications that they've been prescribed in the past. Sometimes the doctors, they'll oversee things and they'll prescribe something that causes bradycardia and tachycardia at the same time, uppers and downers, and so then now the heart rate's going all over the place because your body doesn't know what to do. You've just been prescribed uppers and downers at the same time. And so, could be a mistake, everyone's human. But that's why we have to be educated and know exactly what you're taking and the side effects and what they each do. And so the information here that Dr. B is bringing is amazing. And I've personally gone to Dr. B and said, look, this is what, we've got. And she'll tell me, says, no, this medication can't go with this one. They shouldn't have prescribed this one with this one. And so I personally trust Dr. B a lot. And I go to her And so it's an honor to have you here in our studio bringing this information.
Yeah, thank you. And I hope that's the purpose that we are here is to have the program to educate so we can improve our health. We're not going to do it in one day, but little by little you get the information and then you process one day you apply to your life.
That's right. That's right.
Yes.
Well, thank you, Dr. B,
You're
for making the
welcome.
time to come
Mhm.
out here and talk to our audience. If you're watching at home, share this link. Follow Dr. B. She'll be linked and tagged on these posts as always. And give her a call and set up an appointment and get your questions answered with Dr. B.
Thank you.
Thank you for watching and thank you for listening to 97.7 FM. Until next time, keep it tuned right here. Don't go away. We've got some more shows coming up live only on 97.7 FM, The City.